As we reported, President Biden has tested positive for COVID-19. The White House released a statement saying the president is experiencing mild symptoms and is returning to Delaware to self-isolate. CBS News chief medical correspondent Jon LaPook joins me now. Dr. LaPook, you've read through the doctor's note, doctor to doctor. Help us understand what's happening here.
Well, I was happy to see that he has what sounds like mild symptoms, rhinorrhea, which is basically a runny nose, a non-productive cough, malaise, that means just not feeling well. He tested positive and he's self-isolating. Now, very good news was that his symptoms remain mild. His respiratory rate is normal at 16. That's one of the first things you look at, right? Because it can affect the lungs. If it affects the lungs, you would expect to have labored breathing and breathing at an increased rate. His temperature is normal at 97.8. And very important, what's called his pulse oximetry, I think a lot of us have gotten used to that term now, is normal at 97%. That's putting a little gizmo on your finger, measuring how much oxygen is circulating throughout the blood, or it's a reflection of it. And 97% is plenty high. You want it to be certainly, you don't want it to be under 94%, for example. So I was very interested in the fact that they said that he's received his first dose of Paxlovid. You know, Paxlovid is the medication, we all know about it, that's used to treat COVID-19. And I just checked it again. He has been on a blood thinner called apixaban, which is Eliquis, right? And Eliquis does have an interaction with Paxlovid, which is why you have to be very careful when you give the two together. The Paxlovid can increase the level of the Eliquis. There is actually an alternative that people sometimes give, called molnupiravir, which doesn't have that same interaction, but you know, he has the best advice in the world, and I'm sure they're very closely monitoring how he's doing clinically. And but I just wanted to sort of point that out. When I first saw that he has had COVID, I thought, oh, maybe they're not going to give him Paxlovid, but they did, and I suspect they probably reduced the dose, and they're going to be monitoring him closely.
If you're on Paxlovid, John, does that have any side effects? It's a course of, I can't remember what the course of treatment is for that, but give us a sense of what you can tell from this, how you know, his next week's going to be.
Yeah, well, you know, I've lost count. More prescriptions than I can wave a stick at, John, of Paxlovid. It's a pill you take twice a day. You have to adjust it sometimes depending upon kidney function. There are side effects. People can have GI side effects, some nausea, some diarrhea. Everybody pretty much gets a metallic taste in their mouth from it. It's generally a 5-day course. There has been some discussion about whether it should be longer to try to decrease the risk of long COVID. One thing I will say about long COVID, a New England Journal of Medicine article hot off the presses today said that it was a big study, veteran study, 450,000 people, people who were from March 1st, 2020 to January 31st, 22. And the people who were vaccinated, John, had a much lower risk of long COVID. It was 3.5% in vaccinated versus 7.8% in people who were unvaccinated. So, you know, less than half the risk of having long COVID. So they said in the press release, he is vaccinated, he is boosted. So that's good news. He's having mild symptoms. So one would expect that he would do well. But again, he has, you know, he's an older person. That's the kind of person who we are going to take a close look at, make sure that he heads in the right direction.
And apparently the reporting is he wasn't feeling well and he took the test, but he was at campaign events and that kind of thing. What does that mean for the people he was around today? And it feels like everybody's gotten it this summer, which is just a random.
Yeah, you know, John, right before, because, you know, look, I was, as you can tell how I'm dressed, I was actually on the treadmill doing my exercise when you came in. I ran in here. I'm looking on, you can't see it, but the CDC COVID data tracker, there's definitely been an upswing in the early positivity, the test positivity, emergency room visits, and even hospitalizations are going up a little bit. Of course, if he's testing positive, he was contagious. We know from all the aerosol studies, right, that it's not a matter of 3 or 6 feet. If you're positive, it's in your breath. It can float across the room over time, depending upon the ventilation, especially indoors, if it's not that well ventilated. And it can infect people, you know, across the room. Think about cigarette smoke. If there's somebody in a room with not great ventilation, they're smoking 20 feet away, And can you smell it? Yeah, if you can smell it, then you could potentially get infected. One of the really good things about the data about people who get vaccinated is now today we hear about the decreased risk of long COVID, but there's a dramatic decreased risk of hospitalization and death in people who are vaccinated and boosted.
Given what you just said, John, about spreading once you tested positive, shouldn't the president have put on the presidential mask?
Where do you know where you mean after he found out that he?
Yeah, I mean, shouldn't he have a mask on right now?
It sounds like he said that he is in isolation, that he's self-isolating. Once he turned positive, yeah, the people, it's especially the people around him. You know, I see people with COVID all the time. The good masks, the N95, the KN95s, they're terrific at preventing COVID. If you're like a healthcare provider, if you're the doctor, how do I know that, John? Because in April of 2020, I was on the COVID wards at NYU Langone Health, where I'm a professor of medicine. People were coughing in my face who had COVID. I was wearing an N95. I also had one of those plastic shields, and I didn't get COVID. So, you know, there's sort of been this misunderstanding about masks. Are they effective? They are effective. The better the mask, the more effective they are. And I suspect the second that he tested positive, I don't know what he did in terms of putting on a mask, but certainly the people around him, I highly suspect were masked. And I suspect they might have been masked. If they were suspicious, they might have been masked even during the testing.
Just on that mask point, it also depends on how you got to make sure you're wearing them right? Like, you know, as a doctor, how to actually make sure it fits and all of that.
Yeah, you know, I remember when this first came out. Remember they talked about double masking. You know, when people were wearing their own cloth masks, there was a little bit of a shortage, and it was important to maybe if you double mask it, you could press it down because, you know, there were areas around your cheeks where the aerosols could get in or get out. Now there's really no shortage of masks, so people can get the KN95s. I certainly have a bunch. They're not that expensive for people who, you know, of course they're not that expensive, but still there are people who can have trouble getting them. And I think public health, in the past, public health offices and public health officials have really made great efforts to try to make these masks available, the good ones, to people who are not able to buy them on their own.
John, may I ask you about Eliquis again? You mentioned that the president is on that, and there might be a conflict with the Paxlovid. What's Eliquis for again?
So he has atrial fibrillation. That's an irregular heartbeat where it's like instead of going bum bum bum, it's bum 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 bum. It's sort of an irregular heartbeat, right? And one of the risks of that is that you can get a blood clot forming in the heart, and it can travel up to the head and give you a stroke. So people get on blood thinners, which dramatically decrease the risk of a stroke. So he's been on Eliquis, but Eliquis comes with a price. For one thing, it's a blood thinner, and I've always been worried with him, you know, if he fell, that, you know, that you don't want him to hit any part of his body, but certainly not his head, and get bleeding there. But in terms of Paxlovid, there can be an interaction with Paxlovid where Paxlovid increases the level of the Eliquis. So if the Eliquis level you think is supposed to be one thing and it's actually much higher, and the blood is thinner than you think it is, or than it's supposed to be given a normal dose, then the risk of bleeding would go up. And so that's something that people are very wary about. Again, this is the President of the United States of America, and he's got the best access to the best medical care. So I suspect they're looking at this really, really closely.
And before I let you go here, John, anything else that's a part of this, since I've gotten you off the treadmill, is there anything else a part of this that that came to your mind that we should let the good people out there know about?
The first thing I thought of was I hope his symptoms are mild. You know, I have had, as I said, countless people, including people who are immunocompromised, people who are older, people who are over 90, who've been getting COVID. Now, it's not to say that there's no risk whatsoever. There is a risk here. Let's be honest about it. There's a risk in an older person who's got some, you know, atrial fibrillation, he's on medication. This is not risk-free, but we know statistically, if he was vaccinated, and he was boosted, and now he's getting medication. He's followed closely. You keep looking at him closely because there's no statistically he should do very, very well, but you're not going to roll the dice on anybody. And so when I have somebody who has COVID and I'm giving them treatment, especially if they're higher risk, I make sure that they do exactly what was done. What's his pulse oximetry? Because the danger, mostly with this latest variant, it's been from the neck up. Now, when it starts to go down, which it can do, it can go down to the lungs and then cause pneumonia. When it gets into those little air sacs, the alveoli, right? It can interfere with the ability of oxygen to come from the outside of the body through the lungs and then into, your red blood cells and circulating to your body. So that SaO2, of all the things that I heard, the fact that his respiratory rate is normal at 16, normal is about 12 to 16, something like that. And if you're a little bit agitated, it can be a little higher. But the fact that his pulse oximetry is normal at 97% is very good news. But you can bet anything that he's going to be followed very, very closely to make sure he continues to head in the right direction. And he should statistically do well. But to answer your question, the first thing I thought of was, I hope his symptoms are mild. And I suspect that the President of the United States has been vaccinated and boosted,
Yes.
and that would confirm that he was.
That's right, and the White House confirms that. All right, Jon LaPook, thank you so much. Get back on the treadmill. My doctor tells me exercise is good for you. Thanks, Jon.
Absolutely. All right, take care.